experience is always guiding all of us on for organization of such kind of activity and motivating all of us. I would like to request Goswami sir to take over and deliver a welcome note. Please, sir.
Thank you, Sanjay ji. A very good morning, dear friends. I, on behalf of All India Association of Medical Social Work Professionals, welcome you all, and especially our speaker, Professor Brogan Singh, and our panelists, Professor MC Arun and Dr. Shahid Parvez, and the organizers, Dr. Ranveer Singh and Dr. Sanjay Bhogle, on the occasion of 15th webinar. This is really a pride moment for all of us to participate in this session and enrich ourselves with the current scenario of COVID-19. I must congratulate the organizers for selecting this very important aspect of COVID-19, as many of us are experiencing the painful situation. So the topic today is social stigma and public health in times of COVID-19 pandemic, and this is really playing a very disheartening role. As we all know, the social stigma in the context of health is the negative association between a person and group of persons who share certain characteristics and a specific disease. Now, in an outbreak, this may mean people are labeled, stereotyped, and discriminated against, treated specially, separately, and experience a lot of, loss of status because of the perceived link with the disease. Now, such treatment can negatively affect those with the disease, as well as the caregivers, the family members, friends, and the community. And people who don't have the disease, but they share common characteristics, also may suffer from this stigma. Now, the current COVID-19 outbreak has provoked social stigma and discriminatory behavior against the people of certain ethnic background, as well as anyone perceived to have been in contact with the virus. Now, stigma these people to hide the illness so that they can avoid discrimination, and this stigma prevent people from seeking health care immediately, and discourage, this also discourage them from adopting healthy behavior. Now, how we communicate about COVID-19? This is really is critical in supporting people to take effective action to help combat the disease and to avoid fear and stigma. An environment needs to be created with the disease, and its impact can be discussed and addressed openly, honestly, and effectively. So some of the tips we can address to avoid this compounding social stigma, like using words. We should use the proper words which are familiar with the people and which people can understand very easily. We should also do what is our responsibility or what is on our part. We should, because as being a very good or sincere citizen, we should also obey some of the guidelines which our state authorities or central authorities have really enacted. Then we should also communicate with the tips or messages which are very easy for people to understand. Now, there are many misconceptions and rumors and misinformation which are contributing to stigma and discriminating, and which also hamper our response system, response efforts, or whatever the preventive measures we are going to take. So we should always correct all these misconceptions which people are having, whether this is about the diet, or this is about the behavior, or this is about our living lifestyles. Then we should also promote importance of prevention, life-saving actions, early screening and treatment, so that facts and not the fear will stop the spread of the coronavirus disease. So we should share facts which are very accurate and based on the scientific knowledge. We should challenge whatever wrong myths are there in the mind of the people. Then we should also use the word carefully. The way we communicate also affect the attitude of the people. Now, uh, we have, our eminent speaker from various fields. Thank you, Sanjay ji, and thank you all.
Thank you, sir. It's a great privilege that for this webinar we have Professor Gogan Singh Ekojam, who is the head of the Department of Community Medicine at RIMS and Dean. Mr. Professor Gogan Singh did his MD Community Medicine from AIMS New Delhi. He did MHC in Bioethics from the University of Toronto. Some of the fellowship program that he completed are WIRB Fellowship, Washington, FAIMER, Inclan, LAM, etc. Currently, he is Dean of Academic as well as the Head Community Medicine Department of Regional Institute of Medical Sciences at Imphal. He has been involved in teaching, research, and other social work activities. He has published around 80 papers in the professional journals. He is also a state as well as national trainer in health program activities. He has been the state president of IMA Medical Society, then St. John's Ambulance, Association of Voluntary Blood Donors Association, etc. Apart from being life member of the different professional organizations, in present COVID-19 pandemic, he has been involved in planning, executing, and monitoring of the control activities in the state of Manipur. He has been actively involved in community engagement and mobilization during this pandemic. And with this, we can see that we have a very uh, uh, a shining star to start his oration. Please, sir. Progen Singh, sir, please.
Okay, thank you, Mr. Sanjay, and good afternoon to all of you, all the participants, especially Professor M. Sarun, who is my friend, my classmate, Dr. Sahid Parvaz, from presently Senior Vice President and Head Research, Imphal, Gurgaon, and Mr. Anil Goswami. Well, I think the introduction is a bit too far. I'm not in that way, in fact. And Professor Anil Kumar has already talked about the stigma, a bit about that one. Rather, I think he has talked a lot about that one also. Now, what I'm going to do is I prefer to talk a little of it because we have experts in this field, Professor Arun and Shahid are there, so they will elaborate more on the issue. I'll be giving a broad guideline and how things are going to be, and probably I would prefer that after this meeting, the association, if they can come out with the statistic in India, for example, what things that have happened, as well as some recommendations to tackle this problem of stigma in this COVID time, because COVID time is going to stay for quite some time. Now, to begin with, let's have a look at what is stigma, as everyone knows about that one. It is sort of perceived link as a negative perception of people, and it's directed towards an individual or groups of individuals. And with that one is association with, again, another disease, and in this case, it's the people towards groups of people related to COVID-19. So this is in the context of COVID-19 that we can talk about as a social stigma. is a concept, and because of this negative association or perceived link, thinking bad about an individual, or groups of individuals, so when they behave towards these people, it may be a little different from, or largely different from, what they behave towards other people without COVID. So that is what we talk about as social stigma in short. And there is something that we talk a lot about, the stereotyping. So that, what is this? In fact, this is a generalized conventional image of a person that we have. It could be positive image of a person, or it could be a negative image of a person. Here in COVID-19, the image of a person that we have, like a healthcare worker, by the lay people or the public, when they look at the healthcare worker, the image they are having is not a positive one, it's a negative one. So it's a negative stereotyping by the people. So again, it is a part of the whole cycle of, or the whole domain of this stigma. Now, again, when we talk about discrimination, probably this is the manifest behavior of people towards these people whom they are stigmatizing. So that's the behavior. Now, coming to the types of stigma in general, broadly we can divide it into two. One is enacted, sort of external one. So this stigma is imposed towards other people or on other people. And the other one we can call is internal or enacted. That means because of those stigma, people, they don't want to mix up with other people. And they usually stay aloof apart from other people. And in that process, they become sort of isolated from other people. And that is what we call as enacted. Felt stigma or internal. Both of them are interrelated, and both of them will lead to depression in the long run, and sometimes suicide. That we have seen in certain cases, even in Manipur, we have seen certain cases of suicide during this COVID pandemic. I'm not sure whether it's really related to these activities or not, but I think one of them might be related to that one, because she was a young girl studying in Punjab and came back, and then released from the quarantine center, and at home she committed suicide. And probably there might be something to do with the discriminatory behavior or stigmatizing attitude of the people at home. Now, coming to what we have talked about, and let's dwell a little on why this is happening. One of the most important things why this is happening during COVID time is the disease is unknown. Largely, we don't know about the disease. We know a lot about this disease, COVID-19, by now, but there are all sorts of things that we don't know. And usually, we associate these unknown things with a fear. So there's a fear of the unknown, which drives us to do things which we will not do normally towards other people. The second thing is about the rumor that people are spreading all around. And this rumor is also interconnected or connected with one epidemic that we are fighting along with COVID pandemic. That is what we call is infodemic. In fact, we are fighting 4 epidemics now. One is COVID epidemic. Second one is infodemic. Third one, I don't know whether it's present in other parts of the country or not, but in our part is present rampantly, and it is, I term it as photo charitydemic. People are giving charity like anything without using masks and posing in front of the photo and posting it in the newspaper, in the social network, full of them at this hour. Instead of really helping people, sort of popularity. That's the campaign that they're doing. And the fourth epidemic is now the stigma epidemic. Now, because of the stigma we have seen all over the world, so also inside the country, there are all sorts of incidents where the stigma is manifested in terms of discriminatory behaviors towards people. So I'll be talking a little about that on. So there are four epidemics as of now. So coming to the infodemics or rumor, which is cause for this stigma, as we all know, if we look at Facebook or the WhatsApp, be it the television, be it the newspaper, wherever we just open, they are full of information regarding this COVID-19. And many of them are not true. Many of them are not based on the facts. But since they are circulated widely, what is happening is that people have a wrong perception about the disease. And that again leads to this stigma. So that is the second cause. And let's talk about who are the people on whom this stigma is directed. So the first one is, we talked about before, it could be directed towards an individual or groups of individuals. So oftentimes, the stigma is directed towards the frontline workers, more so particularly the healthcare workers. So healthcare workers are the sort of victim of this stigma or discriminatory behavior as of now during this pandemic, all over the world as well as in India mostly. These healthcare workers, what we are seeing now is that they are not allowed to stay in their homes because the community people are afraid. They said that you go back into hospital, stay in the hospital, stay elsewhere. They are not allowed to enter. They are not allowed to go out to do their duty. If they stay in the rented homes or house, apartments, again, they are driven out of their apartments. And sometimes even on the road when they are walking or going, they're having abuse, verbally and sometimes physically. So a whole lot of things are happening towards these frontline workers. It's not only the medical personnel per se, but other frontline workers who are involved in the quarantine centers, who are involved, even the police person, and other people who are actively engaged in public activities. All of them have been discriminated in that. So this stigma is directed towards, number one, towards these frontline workers, especially the medical personnel. Second one is directed towards those people who have recovered from this COVID-19. When they go back to a school or institute, we have heard of these incidents where they have been discriminated, they have been ill-treated, even in the institute itself. So this is another group of people on whom stigma is directed. So these are the people who have been discharged from the hospital after being treated for COVID-19. Another group of people are those people, again, who have been in the quarantine for 14 days, and after that they are discharged home again. They face the same fate as those people who have been discharged from the isolation ward, public ward again. So again, this is the third group of people. And on a larger plane or larger group, yet we have heard of people being discriminated in the group in terms of the racial or ethnic group. For example, at the beginning, all over the world, those people who look like Chinese, they have been discriminated, saying that you go back to China, that you're copied by us. Even in India, those people who come from Northeast have been called as Corona, and lots of incidents we have heard a lot. So this is a form of stigma directed towards the group. So this is the fourth type of people on whom this stigma is directed, or these group who suffered a lot of this discriminated behavior from other people. And now let's have a look at the impact of all these stigma and discriminated behaviors. Number one, when we have this stigma and discriminated behavior towards who the people it is now, it prevents people from seeking healthcare. Since they prevent people from seeking healthcare, even if the person is having signs symptoms, even if the person is having a disease, wants to go to the hospital again, the community is not allowing them to go. And even after reaching the hospital also, sometimes they are asked for COVID negative certificate, until unless they have that one, they are not treated again. This is also a form of discrimination by the doctors again. So both ways again, they are on the receiving end. So this is an impact that we are seeing, and because of this again, the disease or the COVID-19 virus, SARS-CoV-2, might increase transmission. And not only that, it will increase the morbidity, that is the disease rate, as well as it might even lead to increased death rate. So this is one thing that we need to think about. The second one is it also discourages people from adopting the healthy behavior that we are talking about. For example, wearing a mask, having a physical distance of 2 meters, washing your hands whenever it's needed, and don't crowd in a room with many people. Those are some of the things that we talk to people again. And we have this sort of stigma and discriminative behaviors again. It hampers, or it discourages people to do to adopt such behaviors, good behaviors again. So that is another impact that we are seeing. And of course, again, if it is happening in this way again, invariably it will lead to psychosocial disorders or impact. It has an impact, psychosocial impact. People, the psychological well-being of the people are being compromised. And so these are some of the impacts it might have, and it might have a long-term effect. Again, we don't know exactly what it might have, but it might have a long-term effect also. So these are sort of impacts or the outcomes or the consequences of stigma and discriminatory behavior that we are witnessing in this COVID time. So lastly, I would like to dwell a little on how to address this one, the do's and don'ts. So the rest of the thing, the details will be spoken by the other experts. Now, as Dr. Anil Goswami was talking about, it's very important that when we talk to people, how we refer to people. The WHO, for example, the UNICEF, Red Cross, International Federation of Red Cross, they come out with certain recommendations regarding that one. And they call it something like the people front words. Like you have to use words with people in front rather than suspect. For example, a COVID suspect. When we say suspect from the legal perspective, it looks like that is a criminal. And so in order to avoid that one, so for example, a person who is likely to have COVID-19. So in that way, this is people-centric or people in front word. This is some of the word that we need to use. It's not only the lay person, all professionals working in the field of COVID, as notably the media persons. When they write, when they talk, better to use such type of words. And instead of saying that COVID victims or COVID cases, better to say people suffering from COVID-19, people recovering from COVID-19. These are few words, there are a whole lot of other words, which is sort of a people in front of people-centric words or phrases that we better use such word. Otherwise, if we use something like COVID cases, COVID suspects and all, it creates some fear in other people as if they are going to spread the disease to other people. So such words are supposed to be avoided. So number one that we need to take care of, we need to be mindful of is the words or the phrases that we use to address these people. So it's our most thing that we. Second one is we should stop spreading rumor and infodemic. So as a person, as an individual, forget about the profession. As an individual, when I got a message, I need to look at it, whether it is coming from where, it is the truth, or you should have some effort, put in some effort to verify whether it's the truth or not. And only after that, you think that is credible source, it's the truth, which is coming up, and then it's worth sharing with other people. Otherwise, please don't share this sort of information. So now the WhatsApp, Facebook are flooded with these all sorts of information, not only information, bad things that happen in the quarantine center, bad things that happen in the hospital, bad things that happen in the isolation ward or the COVID ward, they are all posting in the social media. And when people look at it, it creates some sort of negative aura among the people, and that also leads to this stigma. So we should be avoiding this infodemics. We should not be part of it. And the third one is we need to follow whatever norm the government is saying or the state operate when they come out with that again. I'm not sure about how it's going in our country because I hardly see television at all, but in Manipur also I can say that it's not happening that way. That is something what we call as risk communication. So whenever something bad happens in a large scale, something like this, disaster, even pandemic is a disaster according to the classification. So risk communication is very important. What we need to tell the public is, because it's a new thing again, people are anxious, they are afraid of the unknown. So in order to quell all this anxiety and fear, the government has a responsibility to communicate to the public. So that is in the form of risk communication. And in risk communication, what should be usually done is, first one, they need to tell about the facts of the disease. They cannot hide in doing that. They have to tell the truth, but they need to tell the facts. If they are not able to do something, they need to tell them, we are not able to do this one as of now. They have to tell the fact. They cannot hide the fact. And then they need to tell people, okay, even if it is like this, these are the things that government is doing for the public. So we are doing like this, like this, like this, like this. So that will instill some faith in the public, as well as that will motivate people to do things. And third thing in the message they need to tell the public is, since government is doing like this, please help us and you need to do this, this, this. So those do's and don'ts again, this has to be communicated very often by the government machinery to the public. I think why this fear of the unknown, the infodemic is happening is mainly because of lack of this communication with the public. Because many of the public, they even don't know WhatsApp, they don't have Facebook. It's still then, even then they hear it from other people. So the credible source, what it's all about, and what we are doing, and what you need to do in order to fight the disease together. So these are something that the government or the state authority in each of the states need to think about. And another thing that we can talk about is that we can appreciate people when they do some good works again. So appreciating people, that will motivate people to do more work. So it's a must that we should be doing it. So we should be observing, we should be narrating stories, we should be telling them anecdotes where good things happen, not only for the doctor, but anywhere. If good things are happening, better share them instead of sharing bad things. Next, we need to engage the social, the community, especially the community leaders. It may be the PRI, that is the Panchayati Raj institutions head, the religious leaders, or if that is whoever who's influencing the community, engaging them, educating the people, telling them not to discriminate people, and why people are doing like this, making them understand. That, I think, will be a very important step in fighting this stigma in the community. And of course, as I said before, last I would like to talk about this media people again. I think the government or even the media cell of those state, the control room or the public activity people, they should be engaging with the media people to report, to talk about COVID, what should we talk about and how it should be reported. Even the words that I was talking about before, when they report something, those words, they need to use it. And they need to discuss more of things which people need to do or to follow, rather than discussing on something that people don't understand, which is not very odd. For example, so now, I don't think that it's worthwhile to discuss about the reinfection that's happening in a smaller scale to in India, recently reported that this reinfection happening. So calling the scientists and talking about the viral genome. And that sort of discussion, it makes people afraid. because oh, things are happening in a different way. So I think those things has to be avoided discussing on the television. More so, and another thing is about the vaccine again. So people are discussing a lot about the vaccine. So again, rather they can say, okay, fine, in the next year or so, people are trying very hard to come up with a vaccine, and probably we might have it. But instead of that one, the nitty-gritty of the vaccine development is phase 3, discussing all about that one, making a confused people or confused mind among the public. That again creates fear and sort of anxiety among people. So I think we should be avoiding those discussions mainly on television. Rather, we should be focusing on those things that is known as of now and what people need to do to fight COVID-19. That should be focused more. I'm not saying that we should not be discussing at all about the vaccine or the reinfection and all. That's very scientific. We can discuss it, but that should be lesser in number rather than it should be more. We discuss about that one. And what about I just talked about? The opposite of that one will be the donors. So I think I'll stop here today because we have lots of other experts who will be dwelling more on these issues. With this one, I think I'll stop. I'm taking a long time. Thank you, Sanjay. I can't hear.
Sir, please mute answer.
I can't hear.
Hello, Sanjay ji, go ahead. Hello.
Hello, please go ahead. Next speaker.
Sanjay ji, you need to switch on the mic. Your mic is switch off.
Yeah, it looks like I can't hear anything.
Okay.
Please.
Thank you very much, sir.
Yes.
I'm sorry. Thank you
Okay,
very much, sir, for your word of wisdom. Words are like two sides. Healing the people. On the other side, they are killing the people. We should use word to heal the people and not to kill the people. And in this pandemic situation, we should avoid the rumors all that we have told to us. Now, I would like to invite Sri MC Arun Kumar sir, who is a professor of anthropology, and his brief intro I would like to give is that Mr. Arun Kumar sir is teaching social and cultural anthropology as a professor in Manipur University. He is currently HOD of Department of Psychology, Manipur University, and director of Center for Myanmar Studies. He worked on disability and HIV education with Australian International Health Institute and got Australian award for leadership program in 2008. He had many books and articles published, including of health issues to his credit. He is associated with All India Radio of Imphal and local cable network as a news analyst and discussant. I invite Dr. Arun Kumar sir for his word of wisdom. Thank you, sir. Please.
Thank you, Sanjoy. When I am asked to share some of my views on social stigma during this pandemic, COVID pandemic, anyway, thank you for giving me some opportunity to share some of my views on it. Anyway, may I share my PowerPoint presentation?
You can present. At down there is a present now करके है.
Yeah, we are seeing.
Yeah. Can you see it?
We are seeing.
Yes, sir.
Yeah. So what I would like to share some of my views on this social stigma around COVID-19. Very devalue them. That means social stigma is a rather than individual problems, and it is formed at a group level and shared within a group, and it is associated with de-individualization of the others. So when we say, when we look at the other people who are stigmatized, we don't see those individual, the other individual as an individual. Rather, we treat them as half individual or having no value as such. And individual, therefore, when we have a stigma, that individual looks to the group he belongs to for cues for his or her action or behavior. Then let us discuss, let us see what we know of COVID-19 via media, including social media or medical education at a mass level. I'm not talking about the discussion or the lesson, what you are doing in the medical colleges or medical research institution. But when we are the people, general people, the laymen, they have the knowledge of COVID via media or medical education given at large scale via electronic media or print media. The first one is the origin and the nature of the virus is controversial, highly charged with politics. This is one impression we have. This is one idea we have. Therefore, we have the uncertainty. We have a sense of uncertainty when we hear this one. And another thing is, it is pandemic and having no drugs or vaccine so far. Again, the venture to find
Sir, presentation, Mr. Arun Kumar, sir. Hello.
Apparently,
Hello.
he has signed off. He's dropped out of the call.
Yeah, I think the net connection is something wrong. Can just someone can call him up and ask if net connection is okay or not? Or otherwise, we can go to Mr.
So, can we continue with Chai, sir? Till you get connected.
Connected. Okay.
Let's wait for a second.
Yeah.
I suggest he might be back soon. There may be a power disconnect or something.
Looks like that.
Do we have a direct number?
I think so. The organizer might.
Yeah, the organizer, I suggest please take a minute, call him. If he's unable to join, I'm happy to come on board. Is he back?
Not yet.
No.
So Sanjay, you have his number?
Yes, sir. No, I don't have, sir.
Ranbir is having.
Ranbir, sir, is
Ranbir, are you there? Ranbir. Mr. Ranbir. Ranbir. Okay. It's going to take time. I think Sahid can take over.
Okay, I can take the floor. When Mr. Professor come back.
Hold on, sir. Please let me introduce yourself.
Okay, please go ahead. Just one
Dr.
line.
Shahid Pervez, the third panelist with us. Dr. Shahid Pervez is an international development consultant and with a PhD in sociology and social anthropology of development from the University of Edinburgh, UK. He works for government, profit, and non-profit organizations to improve the quality and organizational use of their monitoring, evaluation, research, data collection, and result measurement. He has about 2 decades of experience in development and sociology, extensive field experience in India, Southeast Asia, and in Latin America. He is currently head research internationally as a senior vice president at Social Consultancy Services, that MCRIN. So I welcome Shahid sir to take over and go ahead, please sir.
Thank you so much, Sanjay ji. Thank you, Professor Angmocha. Thank you, Ranveer. Thanks a lot. First of all, I'd like to thank all India medical social worker professionals, each one of you individually, those who are present here, to have such a gathering, to find time to come together, to stipulate, to debate, to listen, and to discuss, and probably find some practical guidelines to take with you. I'm really very pleased to be here with you guys. I do not really belong to the world. I think the only thing that connects me here is what we call commonly research. So I basically do research. Even when I'm not doing research, I say I do research. That's the life of a researcher. It's 24/7. So I haven't done formally any research right now on the impact of COVID on public health, which is actually one of my core areas. I have a PhD in public health, whereby I looked at how public health issues are constructed. Public health issues are not inherently medical in nature, are not inherently biomedical in nature, are not inherently genetic or in other medical language term. I guess Professor Arun Kumar is back here. It would be very kind of him to come on board because it would otherwise sound disconnect. Professor Arun Kumar, you need to switch on your mic first. With due apologies,
I'm sorry.
with due apologies, I took over.
Yes, please go ahead.
I'm coming back. You please continue. I haven't even started. Please continue. These things happen. That's the limit of the world. That's what Corona is teaching. We are limited now.
Sir.
I think he's uploading the presentation.
Yeah.
Okay.
Can you see it?
Not yet.
Not sir. Not yet, sir.
Not yet.
Try again. Maybe switch off and switch on again.
Yeah.
Yes,
Can
sir.
you see it?
Yes, please go ahead.
Yeah.
So,
You were talking about this virus, about which we know nothing.
So we have some knowledge about the virus, and we have some information from media and other medical education that the origin of the virus is controversial, unknown. Therefore, we have in our mind, in our psychic life, we have some uncertainty, a sense of uncertainty we develop. And it is pandemic and having no drugs or vaccine. Therefore, we have a fear or a panic. Then this virus can be transmitted very easily. This information, it helps in furthering our fear. Then lockdowns, distancing from others. That means the other we start or we develop certain hatred attitude towards the others. Then elderly persons and having other disease like diabetes, they are more vulnerable. They have more higher risks. This information gives another sense of fear. So what option we have? The only option we have is the luck. So in the cartoon, everything is fine until you are not chosen. So this is the current situation about the corona. This is the picture of the entire social picture or the cultural picture of this disease in the mind of the people. So you will see, in order to combat the coronavirus, a new coronavirus or the COVID-19, we do no international travel, no interstate transport, no inter-district connectivity, no inter-village movement. That means still today we are saying don't go out unless highly necessary. That means this gives us and this helps us, or rather it forms the only our locality attitude. Therefore, in different parts of India, especially in Manipur and other parts of northeastern India, the villages are locked down by the villagers. They fence the roads so that the others or the outsider should not come to our village, to our locality, thinking that the others are the source of coronavirus. Therefore, and another thing is that COVID warriors are the front runners. This is the message we give out to the people. But what the mass understand is respect doctors and the nurse who treat the COVID-19 patients with least available medical resources. This is what we say to the mass, and we ask them for banging the thali and all that things, and respect truck drivers who go out anywhere, COVID-19 zone or otherwise. When we are locked down, that means we are free from the virus because we are locked down, we are in the home, but these truck drivers are moving here and there for our essential items. And another thing is respect. What we see, what we say to the public is respect security personnel who maintain law and order by frisking a person in lockdown days, meaning touching, talking, checking others in order to maintain the law and order. Therefore, we have an image of doctors who who treat with COVID-19 and who are in close contact with COVID-19 patients, truck drivers who goes here and there while we are advised to live in the home safely, and this security personnel who are touching everyone who are diseased. And the another thing is why this stigma is all about. Why stigma is formed in the mind of the people. It is for personal safety, is advised by the medical educators, and it is a strategy for prevention. A negative attitude arising out of the collective fear of the disease and thus develop stereotypes. So we can think of what answer would be if I ask, who is likely carrier of coronavirus? Doctor who treat COVID-19 patient, or a school teacher having no class in lockdown days? If I ask this question to a layman, what would be the answer? Therefore, this answer, the very answer is very much related with the stigma formation. the best solution to the pandemic is to prevent ourselves from contact with others, including probable carriers. And these probable carriers are the doctors, nurses, health workers, the truck drivers, and police personnel. This is what the people perceive or conceive. In short, the stigma is formed with because it is a new disease with full of unknowns. And these are this idea comes from the media. And man by nature is afraid of the unknown. There is no certainty in near future too that we will know the virus fully. This is our impression. We have some idea from the media and we have our impression. And what is our response is we have a fear with fear of others who are probable carrier of the virus. Therefore, the stigma around the COVID-19 is thus formed. Then we can learn a lesson from HIV education. HIV at the initial stage was protected as unmanageable and no medicine and no treatment. The HIV slogans at that point of time and the education at that point of time targeted to sex workers, homosexuals, and drug addicts, and hence they were highly stigmatized. Ambiguous words like transmission through blood. This transmission through blood in many Indian languages, it also means genetical inheritance. The inheritance through blood means genetical inheritance. So there is a ambiguity around the word transmission through blood. Therefore, if one is HIV positive, then his or her sons or the child would be HIV positive. Such meaning was taken out of these ambiguous words. That means fear, uncertainty, and unknown factors form a strong stigma against the HIV and the probable carriers. Then let us see, it is the recent photographs of COVID pandemic. Here, in the first picture, you will see one mother and her children on back coming from other parts of country to and reach Manipur, the border of Manipur, in a special train. And in the deserted railway station, nobody was there to look after and to advise. And mother is having face mask, but the child on her back is not. And nobody nobody advised her or the child. Asking the child to cover his mouth or nose. Allow tất cả bạn. It is all right now?
Yeah, sir, go ahead. Yeah.
So,
Go ahead, sir. It is all right. Go ahead.
and we always say that half knowledge is dangerous or something like that, but no knowledge is half. Knowledge cannot be half. We say in various public discussion on COVID-19, it is either highly specialized medical discussion or common man's discussion on hardship during lockdown. No community specific or cultural specific communication has been done, and people cannot understand or are not supposed to do the strain of the virus or the medical advancement in coronavirus, corona resources, and therefore what the people are doing is they hear something and half understood and fill up the rest.
Hello, Sanjay ji. Hello.
Hi, sir.
Sir is disconnected.
Yeah.
There is a problem. Yeah,
Sir.
can we go further?
Right.
Speaker? Yeah.
Yes, I
Yeah.
think we are aware of the time. The time is running short. I think I should come in now. We will pull Professor Arun back again. He's back. All right. Okay, guys. So I'll start my presentation. No background now. So you can hear me very well and loud, clear?
Yes, sir. Yes, sir. Yes, sir.
All right. So set up the context of my talk. I will quote something. Listen very carefully. This is by a professor of microbiology at the infectious disease. This is the quote is in relation to social stigma. It says, social stigma in COVID-19 is attributable to unscientific beliefs. Quote, I repeat, social stigma in COVID-19 pandemic is unattributable to unscientific belief and improper understanding of the common person. This actually captures the gist of the confusion, of lack of understanding, the lack of response, and the whole aura of confusion that surrounds the issue of the disease, the issue of the response, and the issue and understanding of the consequences. So in this talk today, what are we talking about? We're talking about the disease, the pandemic itself. And then what are we talking about in relation to that pandemic? We're talking about public health response. How or what's happening on the front, or what kind of prejudices they themselves are subjected to. And that is the impact. And then we are also talking about the consequences of dealing with the disease, whether by public health professionals or by the common people in general. That is social stigma. Let me begin by saying things about the disease itself. Professor has led a very, very, very similar and sketch or a similar background of the disease that I'm going to sort of slightly touch on and sort of recapitulate what he said. Something that Professor Mocha has already touched upon, Anil Goswami has also touched on. In one word, how do we understand this disease? We have to think very carefully. So far, our understanding of disease is from the perspective of science. Please understand. When I say science, I mean public science, not the hardcore science. So you understand that there is one science that Professor Arun has touched about that happens in the lab, that happens in the biomedical setup, that happens in the medical institution. And then that science is consumed in a society. When it is consumed by people on an everyday knowledge to act upon, that becomes the public science. So we have been viewing this disease from the lens of public science, right? And that is very problematic to me. So far, we have a scientific view of everything which does not belong to science. Social stigma, for example, is not a subject matter of science, right? Public health is not a matter of science. It is a matter of social science. It is a matter of humanists. It is a matter of philosophy. It is a matter of social workers, right? Now, so that is one point I want to highlight. When you look at the pandemic from the scientific point of view, you get nothing, no certain answer. In one word, the understanding of this disease is uncertain. Whatever knowledge that science has generated thus far has also contradicted it the next day. That has been the trend on this disease for the last 6 months, precisely about 6 months. Now, to add you something, many of you perhaps do not know, this is not the first corona attack in the world. This is actually the third one, which is global in nature. The first one was in China, 2002, which severely impacted the Chinese population. They controlled it. The second one was on Saudi Arabia in 2012. They also had killed, the disease had killed a lot of people, but eventually they controlled it. This is the third one about which we don't know what impact it's going to generate, what it is going to do, how many people it's going to kill, how many people it's going to not kill or save, and then where it would land us. We do not know. All of us are hiding behind into the knowledge of what we call, what Professor Arun has just said, unknown. Unknown is it's a very dangerous concept to live with. For the human beings, the so-called the civilized people, the knowledgeable people, the educated people, unknown is scary. Unknown is dangerous to deal with. Unknown is something that we cannot live with. Unknown is something that throws us back into the past. Unknown is something that is out of this world, right? And this is precisely the nature of human origin. The human society began with unknown, the travel. So in a way, Corona has thrown us back into a time period where we have to begin with, again, perhaps. And that is sort of redefining the historical moments, redefining the society, redefining our responses. Now, Corona has two aspects to it in terms of its impact. One positive, another negative. Of course, today we assembled here to talk about this negative impact on the social stigma and on the lack of public health responses. Let me briefly touch upon think about our finances, to rethink about how we are gonna learn in the future. Everything. It's a very opportunistic moment. So those who are smart, who are intelligent, who are equipped with the proper techniques are actually using it as a means of production. So in my understanding of Corona, it's a mode of production. It's perhaps a mode of production that if Marx was alive, he would have added it after a capitalist or a socialist mode of production. You see around, everybody is earning an income from Corona. Be it health professionals, be it politicians, be it education institutions, be it corporates, be it war making, be it army, be it any parts of social life. Everyone is getting an opportunity to make a gain out of it. So what I want to say, it's also a positive movement, but then it's also a negative movement. It also has negative. It excludes people. It excludes certain kinds of people and societies who do not have knowledge, who do not have an understanding, who do not have the necessary skills and techniques to deal with. That is precisely the second half, the second part of the second aspect of this knowledge that I'm going to focus about here, and that brings us to the two issues. One is the issue of public health, and another is social stigma. Public health, is Corona a public health issue? Yes, it is. Why it is a public health issue? Well, because it affects the health of public at large, right? But let me tell you, no health or illness becomes a public health issue unless it is problematized. Unless it is problematized either by the society or by the government or by the different sections of society. So we have to understand that corona is becoming more and more of a public health issue day by day. If you follow the discourse of WHO, who is sort of main stakeholder, the main actor, who is a very active script writer of corona, they are the ones who are defining from the day one. You just imagine, in the first week of corona outbreak, they say mask does nothing. It does not protect you. After a few weeks, it tells you no mask is very important, right? First, they tell you there is no vaccine and probably there is never going to be any vaccine for a disease like this. Now they are saying a vaccine is possible and we are working on it. They actively are writing a script that is defining this problem in a particular manner. What is important to distinguish for we do not have any voice to say. For example, I tell you, actually, cities of life, and when you ask them, they say, sir, all of this looks like hoax to us now. They don't care about, they don't wear masks, they don't take any, this is mass of the people returning from UP, Bihar to Delhi, Maharashtra and Andhra Pradesh. I will start with, I'll give you an anecdote. Since I'm an anthropologist by training, my talk will not be complete unless I bring you to the real life event. In June, the second wave of migration, reverse migration started. A lot of people from Delhi started going back to Bihar, Bengal, Assam, even Northeast, because they wanted to go back for a number of reasons. I will not go into the detail, but that phenomena was broadly captured as reverse migration. You may have seen images of these footloose workers and informal workers walking on the road, in millions, right? I was very keenly following that phenomena. One of the outcomes, and that links to actual understanding of what social stigma does in times of COVID. I talked to a couple of migrant friends who were actually either driving, walking, or taking lift to go home. Many people who reached in Bihar, the moment they were going to Bihar, when they reached to the border of Bihar, they stopped by a tea shop to drink a cup of tea. They were asked by the hotel and the local people, where are you coming from? They said, from Delhi. Oh, come on, no tea for you. We cannot serve you tea. Please go away. You are bringing corona from Delhi. The fact is, these guys belong to the local Bihar's village. It doesn't matter. The family suddenly created a line. Corona people, suspected people at risk of corona, and people, those who are not. So anybody coming from the urban space, because we know that the Delhi at the initially stage, Delhi, Mumbai and big metros were the center of corona infection. So they were seen as centers of a possible infection. And suddenly you see the different social categories and facts appearing in people's lives. It started socially stigmatizing people, dividing families along the corona lines. So the social stigma did not only happen within the professional, public health professionals, all of which we know about, that those who served the hospitals, they were completely isolated. Those who were in very close to the corona patients, they were not seen as desirable. This brings to me another anecdote. Just before the lockdown, I was actually out of the country. I arrived back to the country on actually 21st of March when the country was put under lockdown. There was a colleague of mine who was from Andhra Pradesh. So I came to Delhi, he went to Andhra Pradesh. The moment he landed into Andhra Pradesh, the next day, the municipal corporation people came and put a banner on his wall, Corona suspect. The implication of that, putting the banner was immediate. First of all, his immediate neighborhood immediately vacated that. 10 families out, left the houses immediately. That was the initial scare. The very close family members left him alone. Even his wife and children had to take, isolation from him, and he was left alone. 3 days later, the municipal corporation people came again and confiscated his passport, and that became a news. He was seen as a person without a passport. You can imagine a person who does not have passport in India. He's no longer a citizen. He was completely ridiculed. A week after, they came and picked him up physically and took him to a quarantine center. All of this for nothing. He never was positive. He never tested positive. But the damage he had gone through, I have seen it firsthand. As I was following up every day on him, what's happening. I was so lucky enough to survive. I did not go through the same social stigma because in Delhi, what they did not come home. They just kept on calling and say, "Are you okay, sir? Are you okay, sir? You have travel problem. You are suspected. Are you okay?" And I had to push them up by saying, "I'm already fine. Don't worry about it." So the administration was not that crude here. But that person's life is completely shattered. I can see this. This is what COVID can actually do, even to a non-public health professional. Now, interestingly, this person's wife is actually a medical nurse who is still continue to fight. She's one of the corona warriors. She's working in the hospital. Even she took a stand to alienate with him for 14 days. Such is the power of this disease. A disease about which we know nothing. A disease about we do not know how actually spread. I tell you, look at the Lancet, all the medical journals. None of them very clearly says, although there are some evidence to suggest that masks can protect you. But you know what? It's only certain kinds of masks, not the common ones that people wear here. Only N95 assures some kind of protection. All other cotton masks are useless. Based on the RCTs done on viruses similar to corona. Recently, it has been discovered this temperature taking machine does nothing. It tells you nothing. There is no chance that it can stop corona. So all the measures, everything that we have taken, ultimately put us back to this domain of unknown. The point that I'm trying to highlight here, so far we have seen the social stigma, by the way, is also seen and viewed from the perspective of science. Where actually it's an issue of society. It's something that you social workers know better than scientists. It is ultimately the solution lies with you, but not with any scientific temperament. Okay, well, corona has done many good things. One of the good things is it has created awareness for health and hygiene. But at what cost? At a huge cost. The industry is benefiting. They are selling the masks. They're the ones profiting from the mask, from the hand washes and all the corona sort of protective gears that they are selling. Well, Indian citizens to a large extent has understood the meaning of health and hygiene thanks to it, but nothing more than that. At the end of the day, what it comes to, how we deal with the social stigma, we deal with in three ways. This is my sort of prescription and sort of very realistic solutions to the people who are the audience here, the medical social workers. You need to have, first of all, a non-science perspective. By non-science perspective, I mean you need to have a very grounded social science and a humanist perspective. More important than social science is a human. You need to treat another human being without categorizing him or her into any social tags. By philosophy, by value, you are told to treat all the people as equal. You know, one of the things you have to realize that untouchability as a principle in India is banned under the Constitution, Article 17. But you would probably feel and see that actually corona has brought untouchability back into the fore. It has rendered people untouchable. The other way to understand stigma is to understand the notion of untouchability around it. You know, it's not only mental, it's physical. People literally don't handshakes. Luckily, I'm somebody who doesn't. I take enough precaution, but I make sure where I feel safe, I should not unnecessarily create boundaries and divisions. I feel happy to shake hands with people, right? The way I used to do. But of course, when I suspect that there is a chance here that, and that's something that is based on a personal judgment, then one takes precaution. So number one, you have to have a humanist principle whereby you treat your patients, your subjects equally. You have to come back to this basic principle. For you, there is no one there can be people with corona potentials, right? You treat them like a doctor treat a patient, and a patient with an illness, a patient without an illness. Does a doctor discriminate? No, most of the doctors does not discriminate between the patients, whether he or she is an AIDS patient or a cancer patient. How does it matter? So for health social workers, we need to have this paradigm, right? We need to shed off some of our fears. We need to shed off some of our assumptions and go very strong and bold in life, right? We have to take precaution based on what we know. I'm warning. It's not a blind. See, Professor Arun has very clearly said the chances of infection are by chance. No one can predict who is going to be infected, I'll tell you, or know who's going to be saved. There is absolutely no information, no science. Science has reached its limit where it stopped. It does not give you 100% certain answer to this. You have to take a measured, cautious judgment on this and then interact with people. Number one. Number two, you need to understand a little bit more about this virus, which means it necessitates, it calls for more and more research. Some of you I see are doing PhD, some of you are doing a lot of work around the stigma, around the social structuring, around the disease. Please divert your attention and focus a little bit about the impact on the social stigma. Find out the root causes that create prejudices. Find out the root reasons. For example, Professor Angocha has basically touched a very important topic here in a concept called infodemic. You need to do a surgery of this concept. You need to understand a bit. Everybody, as far as corona is concerned, especially the Indians claim to be a doctorate on corona. When they're posting, when they're writing, when they're speaking, everybody seems to be a biomedical doctor of corona. They'll say things with so certainty that you and I might laugh, but millions of their followers say, "Oh, he's right." All you need to do is to scare people. Just bring an element of scare, an element of humor, and an element of unknown. That's all. That's good enough spice for you to scare people away, right? The second thing is do a little bit more research, but grounded. Go to the community, talk to the people, take proper safeguards. Data collection is still very much possible. We are still able to do this. Take feedback.
Mute Ranveer yourself. Mute yourself, please. Please. Mute to yes. Go ahead. Sai sir, go ahead.
Okay. I'm finishing in 2 minutes. There was a little bit of disruption. I could not clearly hear. All I could hear is unmute myself. I have unmuted myself. Can you hear, Sanjay ji? Can you confirm?
Yes, sir. Yes, sir.
Okay. All right. So the third thing related to that is it's a strong prescription for those of you who are into research or who want to know a little bit more. It's a very good opportunity for us to embrace the concept of research. Somebody needs to mute themselves. There's a lot of background noise.
Yes, sir.
Okay,
Go ahead. Yes, go ahead, sir.
So this new concept that's a bit heavy on India is called randomized controlled trials. Many of you may know. We need actually to have a very scientific idea about how this virus can be affected. And this solution lies in doing RCTs. No, small level RCTs. Does not have to be very expensive. Whereby you can select and observe 5 cases of corona infected people. Read out their symptoms, follow them on a regular basis, and then you also control with somebody who is corona free, who's corona negative, who may have similar symptoms, and then do more and more RCTs, not 1 or 2. This is what exactly they are doing on the vaccine right now, right? The vaccine has been ready before the corona was hit actually. Why vaccine is delayed? Because they're doing a lot of RCTs, randomized controlled trials. Until that RCT gives a very clear-cut evidence, they will not launch the vaccine in the market. So we should not wait for the vaccine to come. What we need to do, RCTs on the people's behavior, RCTs on people's perception of the disease. RCT is on the root causes of the stigma, right? So this, in my view, I think there's a very good ground for a lot of researchers to embrace this concept that is mostly used in the medical research, but increasingly in development field, randomized controlled trials. Please do some sort of experimental research in the social lab, not in the medical lab. They will take ages and times to come. The social lab is much more quicker and faster. You guys are already embedded and ready, equipped with this social concept. You know the family, you know the social culture, you understand everything very well, you understand the boundaries, you understand the reasons, and you know the different tags because of which people have prejudices. I think it's very important. I'd like to finish my talk by citing another story. Most of you assembled in Manipur on 5th of February, early this year, for an All India conference. I was one of you who arrived in Manipur. I want to share something very interesting. Most of you have experienced. When I took a flight from Delhi, there was no discussion of Corona. Please in mind, the first case of Corona was already discovered or caught in India on 31st January. So we know that the Corona has come to India. When I arrived in Manipur, I was pleasantly surprised to see that the Manipur airport has these health officials who are testing you for the temperature, who are checking the fever, right? And they were taking a few biometrics also. On 5th of February, when India did not know what Corona is, and then throughout Manipur, Imphal, I saw very good health mechanisms and messages in place. What I'm trying to say is that certain parts of India had already embraced and had a very good knowledge of what was coming to them. Certain people in India already know. The government or the others were fool enough to not understand this. So when I was in Manipur, I realized that a disease is coming. In February, I realized that pandemic is about to break down. Why did for others it took time to understand this? Why did not we learn from the health departments in Manipur? Why did not we took measures and you will realize, you'll appreciate that Manipur still had the far less number of infections than anywhere in India, in the world. But then the social stigma was the most highest exercise on the people from Northeast generally and people from Manipur. I had a lot of friends who were stigmatized and they were referred as Corona people. Shame. We should educate these people by telling actually the people you are saying Corona are actually the knowledge bearers on Corona. They are the first ones to actually show you what Corona can be. We did not learn. So there are lessons around us. There are messages around us. There are clear social structures which can prohibit our response. We need to open our eyes, capture them in our research, and respond accordingly. I'll stop here. Thank you very much. Sanjit.
Thank you very much, sir. Yes, absolutely. Unless we will not open our eyes, we will not be able to see what is going around and adopt the changing scenario, behavior, and the positive part and the positive behavior. That is the thing. There are a few questions from the people who are listening you all carefully. The first one was should our disaster management guidelines for management of public health issues without increasing, they should include these guidelines that health without increasing social fear and stigma. So there should be disaster management guideline में अपना public health management भी उसमें होना चाहिए without increasing the fear and stigma. That is they want to ask.
I have read the guidelines. I have got suggestions. Guidelines is written by guidelines need to be written by taking the feedback from the frontline health workers, like people like medical social workers. There is no voice of representation of them. There has to be definitely a disaster management response. The guidelines, including the one that WHO has issued and the Indian government Ministry of Health has issued, is a useless guideline. It is full of only one thing: have scientific temperament, have scientific believe in science. That is not going to help. We need to take feedback from the people working on the front line, people doing research on this issue, people doing a lot of They are people who understand how public health issues are being constructed. We don't need scientists here. That's my point. We need medical, social health workers. We need their experiences to be brought on. I actually invite all India medical social professionals to please work on the guideline. I will work pro bono. I'll work on that guide as a consultant. It's very important to bring your guidelines and submit it to the Ministry of Health. That guideline should come from the ground. It should not be imposed from what WHO thinks, because WHO does not know anything about corona situation, especially in India. It only relies on data which is dubious, which is very, very problematic, right? So I think the feedback from the social work, medical social work, you should do an internal feedback collection mechanism, and based on that, you should have just these do's and don'ts that these two professors have just mentioned, and that guideline should inform how to deal with a crisis like this. And it can be a very specific corona guideline, because we don't need there is a manual, there is a public health manual in times of crisis like this. But my point is, it needs to be tailored, it needs to be customized, it needs to cater to the needs of the people who are at risk, the medical social workers, so definitely it needs to be revised. It's outdated in my view. I've read it. I'm not sure how many people agree, but it's high time we need to do that if you want to really do some meaningful and constructive work on the front.
I just want to add one
Another
thing.
question is there, how mental health and public health
Sanjay ji, sir,
pertaining to
Sanjay ji, please.
stigma?
Okay, I'll answer this question in very short. It has brought mental health into much more focus. See, the mental health issue has never been talked about in India until in a manner that it has been now beginning to talk about. Everybody is saying they are stressed. You see, the number of suicides have increased, the number of stress in the family have increased, and stress-related health illness has. Nobody has looked at the increase in what we call day-to-day illness that are linked with stress. A lot of people have lost their jobs. A lot of people have lost their relationship. One good thing has happened. It has brought families together, but also it has changed the dynamics of how families work. The husbands and wife are forced to live with the children, which they were not used to, especially in the urban setup. How do they deal with it? There are obviously stress here, and we know for a fact that mental health was a big issue in India for a long time. It was like an atom bomb we were sitting. I think there is some serious efforts, serious research going on in mental health issue right now. A lot of people I know have taken on. There's more and more need, and present it to the government and talk about it. I think Corona gives us a good opportunity for people when the boundaries open, when the lockdown gradually finishes. I suggest people to go back into the field and focus on issues of health illness in their research. And whatever one thing they have to say about this illness, please bring it to the fore, bring it to the front, so that people can share this knowledge. And that's the need of the hour.
Again, sir, want to say Sanjay ji, HOD sir want to say something. Please, sir, go ahead. Again, sir, go ahead.
I invite Ranveer sir for a vote of thanks.
Sanjay ji, Bhongen.
Yeah, I have invited Mr. Ranveer sir for vote of thanks.
Sanjay ji, I think Dr. Brogan wants to say something before the vote of thanks.
Yeah,
Okay.
yeah.
Sir, please.
Brogan sir. Ajay, Dr. Brogan, you wanted to say something? Dr. Brogan, please.
Yeah, I just want to say in something what Dr. Sahid has talked about. When we talk about this disaster management, it's already there. The pestilence is one of the events in the disaster management. And one good thing about the disaster management, of course, as he talked about, it has to be tailored according to the disease or the condition or the event that we have. And we haven't done that one, of course. But one of the things that disaster management should be done or should be carried out is when we talk about disaster, it's not only that department. For example, it's an earthquake. It's not only the engineering department. When we talk about a disease, it's not only the health department who has to work together. So when we talk about disaster, all departments should come together and work together and tackle the problem. So in India, what's happening is that whenever any disaster happens, for example, this itself is a disaster by definition. I already requested the Manipur government a long time back. It's a disaster, announce it as a disaster, work together, come all departments together, work together. Somehow, it's so disorganized in our country in terms of this disaster management. That's what I want to talk about. Because he talked about this social worker coming in. It's not only the social work, people that work with come in order to tackle this problem. There are lots of other issues are there which are related to public. So all together, we have to come together and work together. That's what I want to talk about.
Thank you, sir. Thank you very much. There were no more questions on the sessions. So I would like to Ranbir sir to proceed for a vote of thanks.
Sanjay ji, he is unable to join because he is facing connectivity problem. So can you give the vote of thanks also?
So I on the behalf of Mr. Ranbir Singh sir, who has organized this webinar, extend my vote of thanks to all the dignitaries who have joined us. Dr. Bhogen Singh sir, who delivered he has joined here.
Hello. Sanjay, I'm on live.
Go ahead, Ranbir, go ahead.
Ranbir is back now. Ranbir, do you want to give a word of thanks?
Yeah. Go ahead.
Yeah, Sanjay ji, thank you.
Welcome.
Because there was good evening, namaskar, and good evening to all the participants in this 15th webinar of All India Association of Medical Social Work Professionals, organized by Northeast Zone in collaboration with the Department of Community Medicine, Resident Institute of Medical Sciences, Imphal. It is my privilege to propose the vote of thanks in this academic discussion of social stigma and public health in times of COVID-19. I, on behalf of the All India Association of Medical Social Work Professionals, Northeast Zone, would like to thank today's speakers and the keynote speaker, Professor Bhogen Singh Akoizan, in academics, as well as Head of Department of Community Medicine, RAIMS, for his kindness to be the speakers in this 15th webinar of All India Association of Medical Social Work Professionals. I'm very thankful to very thankful for your kindness to deliver the keynote address in the field of academic, public health, and community medicine. Sir, you are the role model of RAIMS, the light in the darkness of this institution in particular, and for the state of Manipur and country in general. Sir, I am fortunate to work under your guidance. Thank you, sir, so much. Next, I would like to express my heartfelt thanks to Professor M.C. Arun. Sir, you are a renowned academic in your field. So I am very thankful to you for your kind consideration and in my request to be one of the panelists in this 15th webinar of All India Association of Medical Social Work Professionals, organized by Northeast Zone in collaboration with Department of Community Medicine, RAIMS. Thank you, sir, for your kind consideration, despite your very busy schedule in your academic Manipur University. And I thank Sir Syed Pravez for his kind acceptance in my request to be one of the panelists in today's webinar. All India Association of Medical Social Work Professionals, Northeast Zone, is really indebted to you, sir, for your kindness whenever we request you to be part of our program. So you are kind enough to us. Thank you, sir. I, on behalf of the organizing team, would like to thank Professor Anil Kumar Goswami, who is the patron of All India Association of Medical Social Work Professionals, for his kindness to welcome today's speakers, distinguished. Medical Social Work, Community Medicine Department, RIMS. So thank you so much for your kind concern in our request, despite your busy schedule. I would like to thank my heartfelt thanks to President Dia Sekar for his encouragement, and Professor Dr. O.P. Giri, General Secretary, who is instrumental in organizing this webinar, and Dr. Naren Kumar and Dr. Prasan, who is the key persons in technical support. Thank you so much, Dr. Naren and Dr. Prasan. Thank you, Sanjoyji, for being the moderator in today's webinar. And thank you so much, all the participants who are joining in this 15th webinar. Thank you all. Thanks.
Thank you all.